Hello, everybody. So thanks a lot for joining us today for our webinar series entitled Confronting the Drug War, Drug User-Oriented Harm Reduction and Drug Policy. This is our 11th session, and the topic today will be on how synthetics. So my name is Marie-Geoffrey Roustide. I'm a sociologist at the French National Institute of Health and Medical Research, and I'm based in Paris, France. I have the pleasure to be the moderator of this session today. And we have a fantastic panel that will include Tamika Spellman, who will join us very shortly, Yaralix Estrada and Ryan McLean. The roundtable will be focused on what should we do with synthetics by building on existing community strengths in the context of the why and when. So we will begin with a short introduction of each participant to the roundtable, each speaker. And after that, we will begin the roundtable with the question. So I will begin with you, Yaralix. Can you briefly introduce yourself, please? And thanks for being with us today.
Of course, yeah, thanks for having me. And also, I apologize if it's kind of loud. I'm in the Overdose Prevention Center in New York City at On Point, so can sometimes be like loud outside the door. My name is Yaralix. I use she, her pronouns. I'm here as myself on my lunch break. I'm not here representing, like the things that I say are not representative of the institution that I work at, which is the New York City Department of Health, but I am the drug checking manager at the New York City Department of Health. And I'm also a drug checking trainer for the first national drug checking training organization through a project called Drug Checking for the People through Remedy Alliance for the People. And I'm also involved in other kind of like mutual aid projects and kind of some like harm reduction projects related to psychedelics, say organized in New York City Psychedelic Society as well. Yeah, so it's nice to be here and thanks for the invitation, and I'm happy to talk amongst the folks that are here.
So thanks, Yaralix. So I will next move to our second speaker, Ryan. So can you introduce briefly yourself?
Sure. Hi, everyone. Thanks so much for joining us today. So I'm Ryan McNeil. I'm the Director of Harm Reduction Research with the Yale Program in Addiction Medicine and an Associate Professor in Internal Medicine, Public Health, and Anthropology at Yale. And I've been doing work around harm reduction and more broadly issues surrounding drivers of harm among folks who use drugs for almost 20 years now, including work on a range of harm reduction interventions and approaches from sanctioned and unsanctioned supervised consumption sites to drug checking to safer supply. And very happy to join it and talk about a question that's preoccupied me for years, given the profound community impacts, but what can we do amidst the shift to synthetics? So thank you.
So thanks a lot, Ryan, for being here today. And we have also the pleasure to welcome Tamika Spellman, who joined us. And Tamika, can you briefly introduce yourself, please? And you are on mute. Tamika, you have to unmute your mic, please. I don't know if she's hearing us. So you are on mute.
Hello, everyone. My name is Tamika Spellman. I am the Executive Director for Grammy's Place in Birmingham, Alabama. I'm also a member of the North Carolina Survivors Union. And I have been in drug use policy for at least 20 years.
So thanks, Tamika, for joining us today. So I will now move to the questions that we want to discuss today. So my first question will be the following. So can you tell us about the work you do and how you position in the overdose response where you are? So perhaps we will begin with Yaralix.
Sure. Yeah, thank you. Yeah, so I started out doing harm reduction as an outreach worker, like doing street-based outreach work, naloxone distribution, fentanyl test distribution, like working with folks, seeing what they need, et cetera. And then also doing field research, so doing research in the community, primarily amongst people who are at highest risk of overdose in different parts of the country. I started working out in Baltimore, in harm reduction in Baltimore, and then moved over to New York City. So working a lot with like low-income Black and Brown communities, and then expanding as you know the overdose crisis has expanded to other communities, working with other folks. But I currently am the drug checking manager for the New York City Department of Health, and we have 5 sites where people can bring their drugs and get them checked by these machines. They're Fourier transform infrared spectrometers, and we can tell people the roughly an approximation of the composition that's in their drugs, as well as different cuts, and using them in combination with test strips because of the limitations of the machines. And 2 of the drug checking sites that we have are located within our overdose prevention centers. So both of them are on point. I'm in On Point, East Harlem right now. And I can go into a lot of details on like the great things about drug checking, the limitations of drug checking. I think in terms of how we're trying to mitigate some of the issues that are happening is through education and like encouraging personal autonomy by the people that are coming in, because so many people are buying things that they don't know what they're consuming. And by being able to come in and regularly see what's in their drugs, they can also advocate for what it is that they want. So in some ways, we've been seeing how drug checking has been helping correct the supply in small ways, where people can go back and tell their dealer or their supplier that like they don't want this thing, and then they can go back and like try to change, you know, whatever they can within the realm of possibility within what they're selling. Or they can make the decisions to buy something else. But you know, of course, a lot of these issues end up being issues around class, issues around poverty. Like if somebody just bought their last bag and it has a lot of things that they may not want to consume, they may not have an option to not consume that thing in that moment. So yeah, we're working on expanding that program. And outside of this position, I also work with Remedy Alliance to train people in drug checking with these technologies across the country, trying to keep them rooted in like bodily autonomy for people who use drugs, in the participants themselves, advocating to not work with cops. I know that's complicated for some places, but like trying to keep it more centered around people who use drugs and not exposing them to dangers like that lie within like law enforcement, for example, and also trying to prioritize BIPOC leadership when we are able to engage with different organizations. So I'll pause there.
So thanks, Yarelik. So you are at the heart of the topic in New York City, and with also the first overdose prevention centers in the country. Ryan, can you tell us a bit more about your work and how you are positioned in the overdose response from where you are?
Thank you. So I'm based in Connecticut, but most of the work that I've been doing historically has been based out of Vancouver. So before moving to Yale, I was faculty at UBC and did my PhD and postdoc work there. And I've been doing community engaged work around the overdose crisis and more broadly in relation to drug-related harm for a while, with groups like the Vancouver Network of Drug Users, BC Association of People on Methadone, Western Aboriginal Harm Reduction Society, and others. And so through this work, I've been leading a number of studies over the years funded by the National Institutes of Health, CIHR, and others to really unpack what's happening in relation to the social structural production of drug-related harm. And really since 2017, with a very explicit focus on overdose. So through this, I've led a large team of community-based and qualitative researchers who've done studies looking at everything from the rollout early on to drug checking, the rapid scale up of overdose prevention sites, early work around safe supply, pilot-based programming and wider shifts in prescribing practices. So I still keep that work active out of Vancouver. I have an NIH grant and another grant still running for a number of years. And then since moving to Connecticut, I've been getting work off the ground here. So I'll be doing, and I'm currently leading a number of studies in the kind of Northeast and elsewhere in the US, looking at, for example, dynamic shaping risk in relation to fentanyl stimulant polysubstance use among folks who are experiencing homelessness, work around overdose prevention centers, and work getting off the ground soon around the transitions related to xylazine in the drug supply that we're seeing. The work's explicitly community partnered for the most part, and really works to line up research with community demands in relation to organizing and involvement in research, and to do work with an explicit policy focus so that we can, as best as possible, evidence and promote change that can be meaningful to the folks that we get to work with.
So thanks, Ryan. As a researcher, you're very impressed by the links that you have with the community and the importance of your work. So Tamika, could you tell us a bit more about your work and especially about how you are positioned in the overdose response?
Oh my. So I have been working with the Inner Names Network for several years. I am formerly the Policy and Community Engagement Manager for Hips in Washington, D.C. I did the bulk of policy work there, trying to shift the narrative around drug user policy and to change it to one based on health and not criminality. I also work with Black Feminist Futures. I am a leader of a safety pod here in Birmingham, Alabama. I provide housing for Black transgender women who are sex workers and drug users because I don't require them to be abstinent from sex work or drug use. I give these adults a place to stay and focus solely on housing first, and we'll work on whatever problems else you have along the way. I am an abolitionist by heart as a Black transgender woman lived because drugs are in this circle for 4 decades. I out of different things to where
The sound is not
where
very.
person how I took that and I did and put it into the talk members and
So we don't hear you very well because
involved in pro counter. I've also been influenced by Ayanna Presley.
So Tamika, the sound is not very good because perhaps your Wi-Fi or access to Wi-Fi is not very good. So is it possible to stop somewhere to have a more stable access to Wi-Fi, because we don't hear you very well?
Yes, I might need to play on
Sorry,
I think that would probably be better if I just have you off.
Thank you. I will now move to the second question that I have for the.
Sound?
It's not better.
Better?
So perhaps it will be better if you just call and don't use the video. So can you try to speak now?
Yes, can you hear me now?
Yes, it's much better.
Okay, I don't know how much y'all heard. Do I need to start over?
No, but you were explaining us all your experience about the overdose. So perhaps we will move to the second question, and we will hear you better. So can you? So I will stay with you, Tamika, now, as we can hear you now. So can you tell us about the official public health response to emergent synthetics in the drug supply look like at the different level? And what have the response from structures like housing or policing been in your country? And what have the shortcomings of the official response been? So that's a large question.
I guess I should start with that. Number one, housing is a human right, and I have always tried to be inclusive in how I'm providing services for my client base. I am working on the housing model that I'm providing now to expand from state to state because of how harshly we are criminalized as trans women of color for being sex workers and drug users. Drug user policy in this country has gone completely in the wrong direction. It has not done anything but cause harm to people with this war on drugs. It has never been a war on the drug. It has been a war on the people using the substance, and it has caused a lot of negative effects, like with the African American community. So many Black males are in prison for being drug users and being drug dealers, and this is because of how we have systemically been barred from high paying jobs. People need to provide for their families, and instead of us looking at the current problem and relating it to past.
We have lose you again.
Problem came, and the reason why we moved towards race, if we move in that direction as a some regulations is coming in here, we could stop overdoses. We could stop drug tainting, because when there is a bad batch of alcohol, you can go back to the lot and recall it all. We cannot do that with the current way the drug crisis is going in this country, because they're ass backwards, they're criminalizing it, and not looking at ways to change this into a health-based approach. That was what happened when it was alcohol. We have moved away from criminalizing marijuana. We need to be doing the same when it comes to other substances and stop criminalizing the behavior, because that's just what it is. It is a behavior. And it's only problematic when it comes to inner cities, people of color, immigrants, sex workers. I feel like a lot was missed early on when there was, the opioid crisis in the hood, when it was just heroin, and then when it was crack. We had harsh policies, and now that it has crept into the suburban areas of America, it is a problem, and we're trying to do our harm reduction has been recognized, but we need to expand it and do better as a nation.
So thanks, Tamika, for putting on the table the topic of criminalization and the topic of and how it intersects with the social inequities. That's so important to remind us about that, especially in the US, but in Europe too, unfortunately. So I will not now move to Yarelix. So Yarelix, can you give us more elements about what happened in New York City about the emergent synthetics in the drug supply, and what have been the response from structure like housing and policing, and the shortcomings too from the official response?
Yeah, so it's a big question, and I'm not sure like where exactly to, because I'm also, one of the things that I feel is really important that I really admire about what Tamika was saying, that she's like providing housing for Black trans femmes and women that like really need these services, and like that work is intersectional, but it's also inherently political. And I think that there's a lot of movement, especially in the US, to be apolitical, to treat like, I work for a public health agency, but when you're trying to institutionalize something like harm reduction that came from mutual aid, it came from breaking the law, it came from community organizing, and putting it into a sphere like academia or like public health, then there's this at times desire to depoliticize that process, when in reality, like, this is like, I'm a person who uses drugs, I'm a person of color, like, we are inherently politicized because we are criminalized, like Tamika was saying. But beyond that, I think one of the things that I kind of struggle with in thinking about is like, New York City is a city with a lot of resources, but it's also an extremely expensive city, and it's a hyper capitalist city, and it's getting harder for people to find housing, it's getting harder for people to pay their rent, it's getting harder for people to find food to eat, it's getting harder to have like stability, because the ways that gentrification and these different like systems that are causing hypercapitalism to pop up in the city are happening. And so I think, like, as there's more pressures from capitalism to work harder, or there's more stress and there's more of these issues, there is more drug use, and that's not even related to just how there are larger systems related to prohibition and policing. So for example, like in the United Nations in March, and the UNODC, they started to criminalize a lot of precursors that are used to manufacture fentanyl. And states, the federal government and states oftentimes don't know what to do, so they just copy and paste exactly what other prohibitionist laws are doing. And what that does is it creates a more dangerous and unregulated market, or more volatile market, because it forces people that are manufacturing these drugs to look for more easily accessible precursors that can lead to even more dangerous drugs. So for example, like, instead of just seeing fentanyl hydrochloride, now we may potentially see carfentanil, like things like that end up putting more people at risk because they don't know what's in the supply. And so I think from the macro, a huge problem is our economic system. Like, we need more social supports, we need more housing, we need socialist healthcare, free healthcare, like basic universal income, things like that, which, like, in saying those things in the US and in a place like New York City is just kind of like impossible to think about. But if we're moving down to more like tangible institutions, I think New York City is a really interesting place, because we do have 2 safe consumption sites that are sanctioned by the city and in some ways sanctioned by the state. We also have drug checking that's been largely accepted, and we're working on funding at the city to expand it across the city. But there's not enough overdose prevention centers, and there's not enough drug checking that can really mitigate an unregulated supply that something like Safe Supply would be able to offer us. And because of a lot of the things that we're seeing in places like in California and in Oregon and in Idaho, where there's this backlash on harm reduction, politically, there's been more policing, there's been more of this harassing, even if it's not necessarily always leading to arrest, but it leads to people using in more hidden spots. It leads to more people like hiding when they're using, and then that's a higher risk of overdose because they're hiding from police. So this hyper policing isn't working, but it is a huge response from the city to try to respond to issues around drugs. So yeah, I think in general, there's not enough housing. There's multiple crises happening at the same time, including overdoses, but there's also other, like, the migrant crises, and there's a lot of civil unrest because of like Palestine and like things like this. And so I think there's a lot of measures that are being taken. There's not enough measures that are being taken, but without there being a restructuring of our economic system that leads to people being less pressured by capitalism and having less social supports and not having safe supply, it just makes it really hard to have big strides that might lead to decreases in overdoses.
So thanks, Yarelix, for highlighting that the topic and the response is political. That's very important to go beyond public health. So I will now move to Ryan. So Ryan, would you like to speak about where you are now, but perhaps also about British Columbia in Vancouver?
Yeah, I mean, maybe to build off comments that have been made already, but I mean, what we really see that really constrains our ability to have a meaningful overdose response is that the state effectively monopolizes responsibility for how we regulate drugs and what we allow for the scope of intervention. And instead of even locating that within public health, which brings with it many problems in relation to surveillance and social control and the historic oppression of communities of color and folks who use drugs, they locate all of that power with the police, which means that we can't have effective responses. And so what we end up getting is an overdose response that only stretches as far as is politically feasible to do. And as those winds change, as I think we're seeing right now, we see the systematic clawback of things that are even already working, like drug decriminalization and safer supply. And so this has really kind of been, I think, across all of North America, one of the real barriers to a meaningful overdose response is that, I mean, really, the state just doesn't give a fuck whether or not people who use drugs die. And enacts drug laws in a way to promote other things that can be seen as efforts to really just get the worst possible people to vote for them. And unfortunately, we can't have that in this moment, especially if we want to have a meaningful overdose response. So if we take, what's happened around drug decriminalization in both Oregon and British Columbia, where effectively we have recriminalized drugs, despite early data indicating the positive impacts of drug decriminalization on people who use drugs and the wider community. The reality is we had a right-wing, organized, funded, well-oiled machine roll out an anti-progressive drug policy campaign that really, intersects with people's worst, basest fears to create a situation where we could see recriminalization. We're seeing the same thing in wider debates around safer supply in Canada right now, where even folks who are effectively gaining access to a watered down version of safer supply through prescribers are losing access. And so I think, to really hammer this point, which I mean, the other panelists have made much better than me, is, if we see this as an expressly political project in responding to the overdose crisis, then how we organize ourselves and respond need also be expressly political and concerned with building off community organizing, challenging things as best possible, and finding other avenues to move forward. Because otherwise, we're in a situation where we only get the response that's politically feasible or acceptable in any given setting. And let's be honest, like in the US as well as large parts of Canada, people really hate people who use drugs and people who are racialized, especially. And so you can't necessarily wait for public opinion to turn around. So what then can you do to otherwise exercise power and find ways to change things? I think we have an excellent example of that. Unfortunately, dealing with state intervention right now with the Drug User Liberation Front, running a small scale safer supply program to provide people with safer drugs, and they've been charged. And it's, I would anticipate it will likely turn into a constitutional case. And so that's an awful scenario to have to go that route to provide meaningful supports to people and even to allow communities to organize to keep themselves safe. So if I'm sounding bleak, it's because I kind of feel that way right now. We're in pretty horrible times when it comes to all of this. But I think, that I think pushes us to have a necessary rethink of the ways that we act and specifically acknowledge, recognize, and move forward from this idea that public health will save us when public health, especially across most of North America, is completely apolitical in ways that it sure as hell can't save us. And so maybe we should stop looking there.
So thanks, Ryan. Unfortunately, what you just said echoes so well about what happened in Europe now. I don't know if you hear about the elections in Europe and the increase of the extreme right movement, who will unfortunately have negative impact on harm reduction implementation. So we are not so optimistic. And I will now stay with you, Ryan, and move to a question that will give us more hope. I hope. It's about the communities. So and how could you explain us about how communities have responded to the overdose crisis and the emergence of synthetics in your area through organizing, but also through civil disobedience, and how community have may be able to propose innovative interventions in an area where the state have often abandoned people.
Yeah, I'll be brief because I don't want to take space from the other speakers after a ramble. But I think what we've really seen across the overdose response is that innovation's been driven by communities of folks who use drugs consistently at every turn of the overdose crisis and before it. I mean, stretching all the way back to early syringe exchange programs. Communities of people who use drugs have organized to gain access to the tools that they need to keep themselves and their communities safe. And so we saw this in a meaningful way in Canada and also selectively in the US. And we could probably talk about it a bit more widely, if not for the fact that folks would be at risk legally. But the first supervised consumption sites that we're running were being run by people who use drugs and harm reduction organizations, adapting approaches to providing safer bathrooms, operating underground sites, or in the case of what we saw in BC in the early days of the overdose crisis there, just opening unsanctioned sites because too many people were dying and it was unacceptable for folks in the community to lose people in ways that are preventable. And, if we carry that on through, I mean, similarly, so much of the early work and organizing around drug checking, from fentanyl test strips to more comprehensive approaches, have been community driven. On through to, we for years had and continue to have strong, like, quote unquote, gold standard evidence of the effectiveness of things like diacetylmorphine or prescription heroin and other injectable options for managing drug use and overdose risk among folks who use drugs. And yet it's a lot of the political organizing and in some cases lawsuits that drove that forward as a treatment option in Canada. On through to what we see with safe supply, with, groups pushing forward with pilot programs and an organization like DOLF involved in civil disobedience of just running a program without approval. It's all of this is to say, these have been the innovations that are saving people's lives right now. These are the things that we need to embrace and scale up in a meaningful way to be able to support people and address their overdose risk. And in that calculation, the barrier is always political. It's willingness, its acceptability, and its money. And I think there's incredible hope that these things are working, and certainly all evidence suggests that they are. But I think we have to balance that now with a healthy skepticism that we'll see political movement in this era that I think we've all touched on, of right-wing populist backlash against vulnerable peoples, where drug use gets coded as meaning a lot of different things, be it people who are unhoused, people of color, indigenous folks the right wants to punch at. And that's, again, that's an organizing and a political question, much more than it is one of evidence. So long as the state monopolizes the ability to scale up these interventions because they have access to funds, they're responsible for regulations, and so forth, I mean, I'm hopeful that what we'll see is civil disobedience, because it's the only thing that we can do right now.
So thanks, Ryan. I will now move to Tamika. So Tamika, could you tell a bit more about the response from the community through organizing, civil disobedience, and innovative interventions in your area?
Yes, the civil disobedience
We still have a problem
going on.
We can't hear you well. So we still have a problem with your sound.
It is now of safe syringe exchange.
Mm.
It
So,
is, and I've been trying to press
so sorry, Tamika, but
with people, and
we can't hear you. So is it possible for you to call via phone and not by Zoom? It will be better. And because if it breaks up a lot. So is it possible to call us by phone?
if you can provide me with the phone number, put it in the chat.
Yeah, we will do that.
Okay,
Thanks. So, and sorry for that.
no
Technical.
worries.
So,
But
yeah,
while I'm here, I could go ahead and finish until they
okay.
get me the number. You can
So,
hear me well?
yeah, we can hear you better now.
So I was saying that I have been trying to shift this narrative and push the conversation around drug use being a social activity that people take upon. And just like with alcohol in the prohibition period, people were going to speakeasies, places that weren't really safe. And if we move towards the same type of system with liquor stores being like a safe distribution space, and then bars and lounges being safe consumption spaces, we wouldn't have these issues, because we have them in some form right now. Even this housing model I run is a safe consumption site. It is a safe space that people can come to and use safely. We do not have drug checking capability. That would be something that I would love to have, but that is a prohibitively expensive piece of equipment that I cannot afford at this time. But that is something that I have been trying to shift a narrative around, is sometimes in order to move our political bodies, we need to start trying to appeal to their capitalist ways. And by saying those capitalist ways, meaning that maybe we should be trying to give them an insight on how much drugs actually bring in and how they should be trying to tax it. And we already have the infrastructures in place for, like if people want to go into treatment, we already have that in place. We already treat people for substances. So it wouldn't be like we're doing something different, because we already do that. We already have safe consumption spaces in some form or fashion that have been operating illegally for years. Even as me coming up a child, and I am 57 years old now, I've always known that there were shooting galleries. There were always places people could go to smoke their drugs in relative peace. That was somewhat safe, but we should be taking it to the next level and helping to support these places, because I do it, and I do it in a way that they would never think that this would be going on in my place. And this is how we shift those narratives, and community come in and take care of community, because I have everything they need there at my house. And we have a tendency, if we're doing secondary exchange with people, they're probably doing the same thing, providing a safe place for people to use, a safe place for them to check and see if there is at least fentanyl in the supply they have, or be able to connect them with someone that can check their substances in a case of like in New York.
So thanks a lot, Tamika, for sharing it with us, and sorry for these technical problems. So, but for the last minute, we heard you perfectly, and thank you for participating today. So I will now move to Yarelix. Can you speak about the community response and civil disobedience and innovative intervention?
Yeah, sure. And I'd totally agree with everything that that other folks have already said, that Ryan and Tamika have said. And I think like when I think about this, I think about it in a couple of levels. I think there's on the ground mutual aid that doesn't require the state. It doesn't require the recognition of the state. It doesn't require to be platformed. And then sometimes it's even better to not be recognized by the state, because then if the state recognizes that this is happening, it could be criminalized, and like police find out about it and then start to do things about it. So I think there's that level, and I think that's kind of what Tamika was referencing, that a lot of people, like a lot of harm reduction is still illegal, depending on where we're at. Even in New York, there's things that we do that it's illegal all the time, and we have to do it just because that's what our people need to happen. And we're not going to report these things, like depending on what it is. So I think that there's that level to it, that's always the ethos and like the foundation of harm reduction, of overdose prevention, is like people taking care of each other with the resources that they have, and oftentimes without the assistance of the state, or like intentionally not interacting with entities like governments or police departments, because it could end up being harmful when there is this political backlash. I think the other things that I think about, like a higher level that's complicated, is how harm reduction is being institutionalized. And so a lot of us who like were just like drug users helping each other, or people who were just like outreach workers and things like that, but we're somehow like we were maybe more politically active, are now in positions that we're having to work in harm reduction, right? So like we have at least a 9 to 5 where we're working, and in some of these systems that we're working, we're not allowed to engage in political advocacy because the institutions that we're working in tells us that we can't. And so it's kind of this weird thing where a lot of us get to do the work that we love, but we're also restricted by the laws of our institution. We're restricted by how nonprofits in some cases can't engage in political advocacy. Like I am a drug user, I am an activist, but I can't do it in a certain time of the day because of my job. So I think that there's this weird thing happening, especially in the US, and I'd imagine probably in Canada as well, that a lot of us that really care about this work, that are activists, are also working in some sort of institution, or working in this formal thing that in many ways is inhibiting our ability to do civil disobedience, because we're like at work 9 to 5 serving the community when some of these things would happen. The last thing that I want to talk about that I think is really interesting, and I want to like shout out and highlight my friends Jacob Clary and Brooke Payne, is that they've been leading the way in New York City, and also encouraging other parts of the US to start unionizing their harm reduction programs. And I think that by engaging with the labor movement and like reminding people that like we should have labor rights within our organizations that we work in, and like ways of, because harm reduction is it's so tiring, right? Like so many people burned out, a lot of people end up quitting because they get so tired from doing this work, that enacting unions can be a way to protect workers, but also to start re-engaging with the political system as an entity like harm reduction. So within harm reduction, like having a union within a harm reduction program can help with like worker rights and things like that. But I think in a larger system, it can help us with advocacy, like engaging with that larger political system that we've been kind of like separated from, because harm reduction has been viewed as this like illegal thing that cannot interact with political systems. So if there are unions that can bargain, or can say like, I am going to vote for this person, or I'm not going to vote for this person, and the entire harm reduction workforce that is now being unionized is a big bargaining player in that field, I think that's something that I'm not super involved in. I'm very interested in it, and I'm very supportive of my friends that are doing it. But I think that is an interesting way that we could also consider how we can start working with these larger movements that have a lot of political power that we're not currently like uniting. We don't like have the capacity, or haven't really like worked out how to interact with each other, like housing advocacy movements, labor movements, socialist movements. If we work together to tell them like drug user rights and drug user autonomy is a human right, and these are all intertwined and should be worked with together, as opposed to like housing people being working against us, or socialists working against us, because drugs are such a political issue. So I think I think I think there does need to be more civil disobedience, but like a lot of us are like doing civil disobedience for other things, right? And then there's not a huge contingency of people that are like breaking the law for drugs. And we have seen like with Dolph, like they did that and now they're facing criminal charges and like how do we balance, you know, all of these different sorts of um just backlashes that we can face, because then that makes it harder for us to even do our own job. So I think there is a lot of really cool work that's happening, but a larger question that I have that I'm actually really passionate about, and I think a lot of people that are in the intersections of drugs and drug policy and like larger the desire for larger change um in like social, you know, social justice, social movements is like how do we mobilize with larger movements to achieve goals of like human rights and you know like people being treated well, um, which is a big topic, but it's something that I think that we're the more that we're pushed into corners and the more bleak things look, the more I think we have to get creative and work together and figure out how we can mobilize to hopefully get to a place that we could continue getting more resources for the things that we need, including drug checking, including housing, including safe consumption spaces, but also not forgetting that the reason why we're suffering so much is because of the larger system that we're in. It's not, if we were to have safe supply tomorrow but still no housing, like there's still going to be a lot of issues with people's health and quality of life.
Thanks, Yarelix, for highlighting the fact that we need to have a structural response to be effective. So I will now have a last question that I will ask to Tamika first. Tamika, can you say to us how have emergent synthetics changed the opioid agonist treatment landscape in your country? Ah, Tamika, you are on mute. We can't hear you because you are on mute. I see that you have moved to your phone, but it's not working well. So by waiting, I will ask the question to Ryan and tell us when you are ready to speak. So Ryan?
Yeah, I mean, I think certainly we've seen efforts to expand medication for treatment in both Canada and the US amidst what's been happening. Now it's been piecemeal, it's been hard fought in some cases, especially if we think about the extension of medications into places like prison settings and elsewhere. And certainly we've seen some innovation in relation to treatment. I'm thinking particularly in Canada, where opioid use guidelines have expanded what's available to people to be inclusive of things like slow release oral morphine, injectable hydromorphone, and injectable diacetylmorphine. At the same time, I mean, we have a completely uneven treatment landscape. And we've been really slow to scale up approaches that are actually responsive to what people have grown accustomed to in fentanyl. And so like work we've been doing at a very small scale, looking at, you know, for instance, one program that's combining diacetylmorphine with fentanyl patches, that is working tremendously for people who otherwise are accustomed to injecting fentanyl, but also want some space for like euphoria in the context of their drug use. It's like, it's a really solid setup. And yet it's limited to quite literally 18 people. And this has really been kind of a driving issue. Like, if you take the US, it's like buprenorphine or methadone. And those other options aren't even available despite a very extensive evidence base. And again, like it's just political resistance to the scale up of treatment that's meaningful. And it's also, I mean, I think especially with how we're seeing these folks get involved politically, there's a kind of anti-medication recovery oriented group that's really quite damaging. in relation to our efforts to get treatment scaled up. And so this is kind of goes back to this, like, this is a political question. And one that requires will, because, you know, we're seeing people lose access as things like injectable hydromorphone get positioned as somehow not treatment by people. So, you know, to cycle back, like, this is all structural and, you know, requires us to find different ways to act and intervene. At the same time, like, we have promising medications. So I think certainly we can get there. But also the other part of this whole equation is that, you know, the reality is a lot of folks don't want to be on treatment. And, you know, we don't have many options for those folks right now to facilitate being safer. And so as much as we talk about potential innovations in treatment, we almost need like a cultural shift in how we treat folks who are out of treatment to be able to also be responsive to what's happening right now.
So thanks, Ryan. I see that Tamika is with us again. So very good news. So Tamika, do you want to add something about how have emergent synthetics changed the opioid agonist treatment landscape?
Yes, I did want to highlight an issue that had been happening with like pharmacies stocking buprenorphine for people with prescriptions, and it was becoming a rather big problem across the country. You know, especially in urban areas where
We still have a problem with your sound. It was good until now. We can't hear you anymore. So, Yarelix, do you want to add something about emergent synthetics and the changes in the opioid agonist treatment landscape?
Just, I know that we're coming up on time, so just to be brief, I know that the Urban Survivors Union or the National Survivors Union has done a lot of work around this and advocating for liberating methadone and, you know, like encouraging states and different localities to do this. And I think that is a step towards supporting people so that they can at least feel comfortable. And some of the folks that I work with, they tend to have more space in making and having decision making when they are comfortable with their methadone dose or when they're comfortable in their Suboxone dose, for example. But it's such a high barrier to access, and the system is just awful, especially in, I mean, I know the context in the U.S. There was a bit more of relaxation during COVID. So my team, we were doing methadone deliveries. So we would pick up the methadone and deliver it to COVID hospitals, to people's houses. And then we saw people with take homes with more days than they've ever had in their life. And that was really helpful for them. So obviously we know that there's ways that the system can adjust to meet people's needs. And if people feel comfortable in their methadone dose, they may not go and buy from the street as often and be met with such volatility. But of course, there's a lot of work that needs to be done there, and all of this is, as other folks have said, has been inherently political. So yeah, I'll just kind of name that and leave it at that.
So thanks, Yarelix. So for the conclusion, I will now move to Ryan. So Ryan, can you speak a bit about successes and challenges? We speak a lot about challenges, but can you also speak a bit about successes, and what are the lessons from your area that can be transferable to other areas, such as Europe, that is now confronting more and more to opioids and synthetics overdose crisis?
Yeah, you know, I'll maybe just hit on, you know, what I hope it really is a success of this, and that's that, you know, we have pretty definitive evidence at this point that safe supply is impactful in terms of reducing people's overdose risk and improving their quality of life. And, you know, that evidence, I think, now exists and is out there in a way that can inform how we act and how other jurisdictions like Europe, where it might not be as politically contentious, can intervene to support people. And, you know, I think that's pretty fantastic in terms of how we can go forward. I wish we didn't have to lose so many people to have gotten there. And really, like, this is an innovation that, and I think important shift in how we might think about drugs that, you know, can honor them by keeping others alive. And I really hope that as we move forward, we can find ways to center that in policy discussions in ways that move us forward in that direction, because, I mean, we have a responsibility to, and to do so in a way that actually aligns with what people need and want.
Thanks, Ryan. I see that Tamika is again with us. So, Tamika, can you give us some words for the conclusion about what are the lessons from your experience that we can learn and give to other areas, and especially for Europe, with beginning to face some similar challenges as in the US? Tamika, you are on mute. You are muted. We are listening to you.
Hello?
Yeah, we are listening to you.
Hello?
Yeah, you can't hear us.
Okay,
Can you hear? Can you hear
make
us or not?
sure. So I can hear you. Okay. So one of the biggest lessons that I have learned is that the better informed you are when you go to have these conversations with your elected bodies, the better. They definitely need graphs, bar graphs, pictures, numbers, statistics, you know, because they're very visual people. They don't want anything to read. They would rather have a visual. So that's one of the lessons that I have learned when it comes to dealing with our elected officials. One of the lessons that I've learned when dealing with the public at large is that, again, people are very visual. They don't want to read anything. Try to have a barcode instead of giving out pamphlets. That's easier for a lot of modern people when you're trying to move constituents. You know, give them something that they can do at home instead of just giving out a piece of paper. Make it accessible for them as well. You know, and a lot of people would be more interested in looking at something that they've gotten from a barcode later than to be sitting there and reading a flyer. Sometimes it's a little less, it's more involved when they can read it themselves and when they absolutely have time to do so. Another thing that I have taken observation to is the client services that we provide are not enough. People are still falling through the gaps. And, you know, I try to stay on the cutting edge and being as inclusive as I can and trying to make sure that I'm serving as many people as possible. I may house trans women here at my house, but I go out and I do outreach with the public at large. And as they come to me with a different need, I try to find and source a way to meet it. So those are some of my observations.
So thanks a lot, Tamika. And Yarelix, can you give us some words to conclude about your experience and lessons we can learn from you?
Yeah, I think like all these tools that we generally know about in harm reduction and in drug policy is like advocating for housing, advocating for expansive healthcare, and access to naloxone, access to test strips, access to drug checking. But I think those things should also be paired with doing it in a way that empowers people and that makes them feel like they have agency in their lives and make them feel like they have the ability to mobilize, the ability to that they matter, you know. So I think like one of the things that has been really wonderful about drug checking is just reminding people that they have like this is for them and they have the right to use the drugs that they want to use and to find the substance that is right for them in whatever situation that they're in. And I think that empowerment is something that like the system tries to take away from us so much, especially like as drug users. Being able to reclaim that is something that I think is really foundational, because if we feel empowered and if we feel like we matter and if we feel like we deserve things, and this is for like all folks who use drugs, then there could be a catalyst for change for larger things. But I guess from like institutional, yeah, just like advocating for those like expansions of those things in the lowest barrier way possible so that the most number of people can access and benefit from these different resources.
So thank you, Yarelix. We will conclude now. So thanks a lot to our three panelists, Tamika, Ryan, and Yarelix. That was a fantastic panel. Very, very inspireful. Thank you so much. And yes, harm reduction is political. And we hope that the future will be better. And we will have our next webinar soon, and we'll keep you updated. So thank you all, and have a good day, evening, wherever you are. Bye.
Great. Thank you for joining, everybody. Great
Thank
seeing you.
you.